Let's talk about Waterbirth.
Hi. So we wanted to talk to you about one, how you know if a water birth is right for you, two, what a water birth really is, and three, what keeps water births safe.
So the first thing, how do you know if Waterbirth is something that you might be interested in? A lot of people are attracted to Waterbirth as a way of coping with the sensations of labor and the pain of labor without using medication. So for people who are planning an unmedicated birth and want to try to have a natural birth where all the hormones get to work to their fullest ability, Waterbirth can be a great option because it can help you deal with it when it gets really intense without having to get an epidural or using narcotics in your IV. It's also a really great option for people who are naturally drawn to the water. So if you're somebody who really likes to have a bath at the end of a long stressful day, or when you're not feeling well, it feels good to you to take a shower, and water itself is helpful for you, you might be somebody who really likes to be in the water during your birth.
Yeah, and having a water birth means that you are literally giving birth to your baby submerged in water. Lots of people labor in water and don't necessarily give birth in it, but what we're talking about is actually having your baby while you are submerged in water. And this is something that isn't really an option for the majority of people who are choosing to give birth in a hospital, because providers there, for one reason or another, don't usually support the actual birth of a baby while someone is submerged in water.
So that gets us to what makes water birth safe, and there are lots of different things that make water birth safe, but the most important one is having providers who are experienced and comfortable with managing water birth. There is no evidence that there's an increased risk to mom or baby in a water birth as long as it's managed appropriately. And in the United States, in almost all cases, the people who are the most comfortable and experienced with water birth are home birth midwives, because at least half of the babies that we support to be born are born into the water. So we're really used to it, and we feel really comfortable managing it, making sure that things are still normal, and then knowing what to do if things move outside of the range of normal.
And there are a number of things that we're well trained in to help keep water births safe. The first one is intermittent auscultation of the fetal heart tone. So we're listening to your baby. And we know how to listen to a baby with a mom in any position, including being in the birth tub. We can listen to heart tones underwater, just like we could if someone were on their bed. So we are well trained in being able to listen to baby while someone's in the water, and also in being able to tell signs of progress without actually, one, visualizing the perineum or having to do an internal cervical exam. As midwives, we know how to pay attention to different behaviors and other signs from the body that somebody is making particular progress in their labor and that their baby may be about to be born.
A big question that people ask about the safety of water birth is, won't the baby try to inhale as soon as the head is out? So in a normal physiologic birth, it's very normal for the baby's head to be born just to here, and then for there to be a pause before the next contraction, before the rest of the baby's body is born. And underwater, that can look distressing if you don't understand the physiology of what's happening. What's happening is, as babies are being born, they have nerves on their cheeks that when they hit air will stimulate them to inhale and take their first breath, but only once they've hit air and those nerves on their cheeks have hit air. Before that, they're in an aquatic environment just like they were in the amniotic fluid in the uterus. So for babies being born in water, they will not be stimulated to take a breath when they're under the water until they're brought up out of the water. And that whole time they're getting oxygen through their cord. So babies are continuing to be oxygenated through the umbilical cord in the same way that they have the whole period of pregnancy and development in the uterus. So there's no risk of low oxygen to babies being born under the water.
And once a baby is born, they're brought up to usually mom's chest, and we monitor mom and baby that way, and we see mom and baby as a unit anyway, so we're not in a hurry to detach baby from their placenta, to cut the cord, anything like that. We really just give everybody time, usually just still in the water and really integrating that a birth just happened. And then slowly we help mom to deliver the placenta. We know how to do that while someone is still sitting in the tub. And then we help you eventually out of the water and into your bed.
So that's the lowdown on Waterbirth. If you think that Waterbirth might be right for you or it's something you're interested in and you're in the Portland area, please come do a consult with us. We'd love to talk to you about how to get the birth that you're really looking for. And if you have any further questions, you can always reach out to midwives@hearthandhomemidwifery.com.
All right, see you next month.